So to begin with, what is myopia in simple terms and how does it affect vision?
Yes, I think we can describe it in very simple way. Um, if our eyeball is normal, we can see things very clearly. Once you become myopia, you can still see things in near distance very clearly, but not things far away.
Yeah.
So when we become myopic, some things far away, several meters away, we will feel blurry, blurry.
Yeah.
Yes. So that is what happened to us. So once somebody they become myopic, they have to receive some correction to help them see it clearly.
Yeah. And do you think it's better to call it myopia or like nearsightedness? What do you think is a better term?
Sorry, I have to close the turn off. Like cook tea for you, maybe black tea.
Yes, I will take care of that.
Yes.
You are from Iran, I can do that. So
you can? Sorry.
You also
in China we have to host our guests like this way.
Thank you so much.
Okay. This is black tea. Please enjoy.
Thank you so much.
Thank you. Thank you. Thank you so much. Really,
Thank you.
sweet.
A bit hot now.
Thank you so much.
Thank you so much. Smells amazing.
So let me see your second question.
Go ahead. That's good. Good question again.
Oh,
Okay.
so I was kind of just asking, do you think it's better to call myopia nearsightedness due to the way you described it? Do you think that's a better term?
You mean what is better, myopia or nearsighted?
Yeah, like what's a better way to call it, I guess.
Better way to call it in the professional field in our medical field we call it myopia. But if you make some science popularization to public, you can use nearsighted. But in China, in Chinese, we just called it 近视. 近视 just like nearsighted. Yes. But myopia is the professional words.
Okay.
Yes.
So then my next question is, what happens like inside the eye when someone develops myopia?
Yes. If we treat our eyeball like a balloon, once people become myopic, the eyeball, the balloon become the bigger. We call it the acer lens. Our eyeball gets longer once it is myopic. So just like a balloon being blown up. So along with the diopter of myopia getting worse, the bloom is blown up bigger.
I see, yeah.
Yes, so 放在采访，或者你坐在那里，需要吗？Can she be here together? Okay.
Yeah, as long as you're okay with being recorded, we want to make sure.
So we say as the eyeball keeps stretching along with the diopter of myopia gets bigger.
Mhm.
So the back wall of the eye, what we call the retina, get thinner and thinner, and just like a balloon being blown up too much.
Yeah.
So when it gets too thin, it can develop a weakness, weak spots and tears and detach. And in severe cases, the back of the eye, how to say, bunches outward. In our professional words, called posterior staphyloma. So yes, which can lead to permanent brightness. So so we say myopia isn't just about wearing thicker glasses, but it's about the eye stretching like an over inflated balloon, and that's why we need to control it early.
Yeah.
Yes.
So that it doesn't blow up too much.
Yes, and it can lead to very dangerous implications.
Mm-hmm.
Lead to permanent visual loss and blackness.
Yeah.
And now in China, especially in Jing'an district, our center district, the leading cause of blindness is pathological high myopia. It is, how to say, not it is not the cataract anymore. Before, the cataract is the leading cause of blindness in adult population. Now is high myopia. Yes.
Okay. Yeah, that's very interesting. I think the balloon thing is a very good comparison.
Yes, when I talk the story to children, to parents, I usually use this kind of words to make it more easier to be understood.
Mm.
Yes.
So then, on the topic of parents, what are the early signs parents should watch in children for myopia? What should they watch out for?
Yes, I think this is very important. We need to tell parents what kind of clues they could get, like their kids, what the distance of their kids to watch TV closer, getting closer. For example, before they just sit on the couch, but now they move the distance to
make it closer.
Make it close to the TV.
Mm-hmm.
That is one side, and maybe someday they tell their parents, now I cannot see the blackboard or whiteboard in the classroom clearly. That means they suffered some nearsighted, and also they squeeze or tilt their head to see better, like this, or just how to say, squeeze 眯眼睛squeeze squeeze their eyes to see better. Mm-hmm. And also sometimes they complain of headaches, or it can call it rub their eyes, RUB, rub their eyes often, to see better. Yeah.
When I was a kid, I used to complain to my parents about how I couldn't see during class because of my myopia, because I couldn't see.
Yes, when you couldn't see it in early stage, you may try to rub your eyes to see better. And also, I say you can see some people, some children, they usually very they were usually very friendly to you. They will say hello to you, say hi to you in very far distance. But now they may pretend, like you may think they pretend not they pretend not knowing you because they cannot see you very clearly. And also some children, they may lose the interest to go outside for activities because they cannot see far distance very clearly. I think such clues may help parents to detect their children's nearsight very early, in early stage.
Yeah, so my next question is, my parents, they got me an eye exam when I was very young.
Yes.
Due to me not being able, when I would play with other kids, I couldn't see the ball. Like they would throw something at me, I couldn't see.
Yes.
So at what age would you recommend parents get eye exams for their children?
Yes, from our professional perspective, we recommend kids received eye exams at age 3. Yeah, at least at age 3. So now, you know, in China, because myopia has been a very big issue, public health issue. So now kids in school, they have the opportunity to receive times eye exams per year. So in Shanghai, the program we promoted from 2008 or 2010, just after I been here, we provided the public health screening in schools from to 4 to 18 years old children. So now in whole China, every provinces they are promoting such service to school to make sure all of the kids they could receive eye exams very early in their very early age.
That's very impressive. I wish I had that when I was a kid.
Yes, and also in China now, we encourage parents to take their kids to hospitals to receive psychological refraction measurement, because in very young age children, how to say, the accommodation is very active. You need to receive psychological, and then you can get very accurate refraction data.
Yes.
Because now we encourage them to receive such examinations in time, then you can get a real diopter, even they are still non-myopic. Then we can know how the myopia reserve they have. For example, if one children have hyperopic reserve lower than plus 0.75 diopter, that means they are very close to become myopic. To become myopia, then we will encourage them to receive intensive intervention, not only outdoor activities. So now in China, we tend to try to put the interventions on pre-myopia, not only myopia. Pre-myopia, we think it is very close to myopia, but still non-myopia.
Yeah.
Yes.
So we're talking about all of this. Why is myopia more serious than just needing glasses? Like, oh, I just need glasses. That's what a lot of people think it is. Why is it more serious?
Yes, because regular glasses, we call it single vision glasses, only help you correct your vision to see it clearly, but it cannot help to stop or to slow the progression of myopia. So I don't know what kind of intervention you received during your childhood, but if one children cannot receive proper intervention to control the myopia progression, they will have very high risk to become high myopia before they graduated from high school. So so now in China, we have a variety of intervention measures to help to slow down the progression of myopia, to prevent high myopia. Because we know once we become high myopia, it will have very high risk.
It can get worse.
Yeah, to happen severe complications like high myopia related cataract, glaucoma, and retina detachment, such like these very severe complications leading to permanent vision loss and blackness.
Yeah, I remember they told me about that, my parents, about the retina detachment. It was very scary. So I'm glad there's so many prevention in China. It's very impressive.
Can I know your how long is your eyesight lens? Have you measured this index eyesight lens?
I think AXI, you mean?
20, like 26 or 25 or 27 millimeters. The eyesight lens.
I think it was.
Yes, maybe we can help you to test it after this interview. They have lots of devices in level 1 and level 2. and also your founder's image. We can help you to establish your caps.
Perfect.
Yes.
I think it's 25.
Okay, that could be better. Seems safety because the diopter only one side. The other side is the eyesight lens. Because we say the myopic eyeball, just like the broom, along with your increasing of your diopter, the eyesight lens become longer.
Yeah.
And your eyeball gets thinner, and that is the risk of retinal detachment.
Yes. So then, what are the biggest causes of myopia today? Like, what is the leading cause?
Leading cause.
Yes.
Leading cause of myopia. Okay. Lack of outdoor activity and the I'd say too much near work.
Too much technology?
Technology. Actually, now we still cannot haven't got enough evidences to say technology, the digital screen wasn't the situation, but the burden on near work it does increase the risk of myopia. Because the famous myopia experts like Ian Morgan and Kathy Lewis, professors, they are in Australia. They just staying in here for a couple of weeks in last month, and they always think before the digital screen emerging, the prevalence of myopia was already increasing very crazy, like in from 1950 or 1980s in Singapore, in Japan, in China. But that time, people are all how to say, human society, we didn't get a digital screen at that time. So that is very funny explanation about the impact of digital screen. But we think since the COVID-19 came, nowadays we change our lifestyle very, how to say,
drastically.
Yes. So now we have to evaluate its impact of myopia, but it is still ongoing. But the lack of outdoor time is very specific or very definite cause of myopia. But now we would like to evaluate the how to say the actual risk of near work on myopia, because in past we only realized that once we increase the outdoor time to kids, the onset of myopia reduced. But now we haven't realized that we reduce the near work direction or the sleep direction, then we can reduce the onset of myopia. Now we haven't got such evidences. Yes.
So then, to prevent myopia, how much, or at least delay myopia, how much outdoor time would you recommend for children?
Yes. Our team actually we did very brilliant work on this issue. In 10 years ago, we launched the outdoor activity campaign called "Go Signing for Sight," and that slogan was accepted by our Ministry of Education and Health, Ministry of Health. So now "Go Signing for Sight" is applied in nationwide. So at that time, according to the scientific evidences, we recommend primary and middle school students should go outdoors at least 2 hours per day, and we encourage preschool kids. Their parents should make sure they could go outdoor at least 3 hours per day, because according to our evidences, we think if we want to reduce the risk of myopia very obviously, we need to realize at least 3 to 4 hours outdoors per day. But you know, in modern society, it is very difficult to realize such direction of outdoor. But that is our goal. So such recommendations has been written in our national policy. Yes.
So this also applies to children. This goes for children everywhere, not just here. 4 hours, 3 hours.
You mean in Shanghai or in China?
In the world.
In the world. Yes. Now, actually, I'm one workstream member of WHO Specs 2030 Action in WHO, World Health Organization, and Specs 2030. The action focus on children myopia and adult presbyopia. And when I work with them, I suggest they should put such recommendation on their advocacy document. So now I think in at least in China now, it is widely recognized that we should make sure children go outdoors at least 2 hours per day. But in other places of the world, I think most of professional fields, experts, they have got such messages, key points. But I cannot be sure if the public they have got this very widely. So it needs your your effort.
Yeah. That's
It needs your
that's what
effort.
I want to do.
Yeah,
Yes.
to promote such scientific messages.
Yes. And then, so it's kind of scary talking about all the risks. So, what are the treatments? What treatment options are available?
Available for
Myopia.
control their progression. Yes, now I think China is very lucky. Kids in China, they are very lucky because in our place now kids can receive defocus lenses, the special design on the lenses, defocus lenses spectacles, and also low dose atropine eye drops, and then the also oscillatory, the how to say, the contact lenses wound at night and gently reshape the cornea, and then you don't need to wear the spectacles at daytime. And also the red light, the low level red light therapy, children can receive 3 minutes per time, twice per day. But its safety, its long-term safety is still still under validation. Yes.
Yeah.
So now in China, kids and their parents have a variety of options to slow down the progression of myopia.
Yes.
Actually, now our data, our team's data, we have found the prevalence of high myopia begin to decline because we now have a variety of intervention measures.
That's very good.
Yes, yes.
So then, how should parents choose the right treatment for their child?
Yes, I think that depends on their preferences, and also depends children's age and the speed of myopia progression, and also the cost, the price, because the defocus lens spectacles, maybe it only costs 2,000 RMB in market. You can get RMB 2,000 RMB, and even very big brand like Essilor, like this, maybe about 3 to 5,000 RMB. RMB maybe about 5 RMB, 600 US dollars. And like low dose atropine, if you use it for a whole year, it may cost about 3,000 RMB, 3,000 to 4,000 RMB. Yes, and also it is a bit higher price, maybe 10,000 RMB, and it have to be changed every 2 years. So now the most proportion of intervention that the children received is defocus spectacles because it's very convenient. Yes. So it depends on kids and their parents' preferences. But I think most important thing is they should go to see a very professional, how to say, specialist to help them to select very how to say to formulate their personalized plan or intervention for them.
Yes.
Yes.
One of the plans that Camden and I talk about, that we want to go to California government
Yes.
and ask for the funding for helping, because his prescription for the eye drop is around,
It's very expensive.
is around
We've been paying
$600
per,
and we have a very good insurance.
Per month or per year?
yeah, no,
6 months.
it's for
Six
for a year.
Yeah,
4 years.
4 years, $600.
Yes.
I think it is very close to the price in China.
And this is after the insurance. And
after
if
insurance.
you don't have
Yes.
insurance, you have to pay
Double
thousands of dollars.
Yeah,
It's very bad in the United
Yes,
States.
but now in China, the low-dose atropine 他们进医保了吗？好像也没有嘛。Low-dose atropine hasn't been included in the insurance, medical insurance. So that is our mission as well. We would like to promote them into the medical insurance.
Yeah.
So I have a question. Sorry, I'm taking your time. So the atropine, how long has it been? Because when he was a kid, this wasn't an option for us.
Maybe 18 years ago was not an option. Or what?
You mean
like 18 years ago was
18 years ago. 18 years ago. 6 years old. 6 years old. 6 years old. You can select low-dose atropine. No, I don't think so. So I think kids now, how to say, kids born in current stage is are more lucky.
Yes.
Because the defocus lenses, the technology emerged only in recent years. Yes, not very early before.
Correct. In 2009 and 10, when we find out in 2010, there was no eye drop.
No eye drop, but some clinic institution they made it by themselves. Like in China, some hospitals they were allowed to provide from their old factory. But now FDA in China they how to say they how to say they get the approval. Yeah, they approved. Yes. Yeah. So even in China now, the application of low-dose atropine, the eye drops, yes, it is more convenient in recent 2 years. But also the contact lenses, the technology emerged very early, maybe from 2000. From 2000, yes, the contact lenses, we say okay lenses, also also keratology. So that kind of control measurement measure has been existed for many years. So, but I think it is very successful for you to control your degree at about minus 6 diopter, 600 degree, we say. And luckily your AC lens is still under 26 millimeters. So we say 26 millimeters is a cutoff of high risk of becoming pathological high myopia. So you're still very safe. But you need to be very careful to monitor if your refraction still being progression. Yes. Once they once it is still, how to say, going very fast, you need to receive some intensive intervention.
Yes.
Sorry, last question.
Oh, sorry. Yeah. So then, I guess overall, what is one thing every parent should remember? Like, if they were to watch this, what is the takeaway? What should they remember?
Takeaway. I think now we have to let parents believe that myopia is manageable. Yes. Prevention early. We say it, how to say, how to say, prevention early and act or examine early, act daily, and the last one. What is the last one? The last one. Yeah, start early, act daily, and see a specialist. Start early. We say kids should receive their earliest eye exams at least at age 3, so you can know what kind of your background of refraction. Already myopia or close to myopia, or still have very sufficient hydropia reserve. And at daily, we say go outdoors very frequently, or go outdoors as much as you can.
Yes.
And reduce the near work, or we should take very reasonable break during your reading. Yes. Your continuous reading, like 20-20-20 rules, is produced by AAO, the American Association of Ophthalmology, saying every 20 minutes you taking, every 20 minutes near work, you should sit 20 feet away for 20 seconds. 20 lures. And see a specialist is because we need to take some very scientific messages or personalized plan for your eye health, for long-term health management. So I say start early and act daily and see a specialist.